This is an extraordinary case of a young woman that collapsed during a mountain trek. Her heart stopped beating for a total time of 6 hours and 10 minutes, and now, after what we called extracorporeal cardiopulmonary resuscitation, she's back to normal life. The case report was published in the Lancet journal in May 2020. Very briefly, bad weather caught her and her boyfriend up in the mountains in the Pyrenees. When the emergency services first evaluated her, she was unconscious, her heart was not beating, and her body temperature was 18 degrees Celsius. This is the key point of this case. Accidental hypothermia made her heart stop beating, but also maintain the rest of the organs, including the brain, in a situation, a kind of hibernation that allowed to tolerate them for far more time than habitual, the hypoxia consequence of a heart that does not beat. She was brought here to the Vall University Hospital, where we have an advanced ECMO program, international reference in this matter, and with the ECMO machine we can move and oxygenate very effectively the blood, and so we can substitute the function of the heart and the lungs. And further, we can very cautiously increase the temperature of the body of the patient. And that was done since her body temperature regained 30 degrees Celsius. At that point, the heart, after 6 hours and 10 minutes, started beating again. And 1 month after the episode, this woman has resumed her normal activities.